Hey, it's Dr. Rick, founder of Herbal 411, and I wanted to talk about chest pain. If you are young and don't have risks, then typically the diagnosis is something that can be worked up as an outpatient. That means not go to the hospital. I have risks. Just my age of being 62 is a risk factor. Male is a risk factor. Having a history of controlled hypertension, elevated cholesterol in the past, even if it is controlled now, is a risk factor. And then there's family history. So as healthy as you guys are, my patients, there's still going to be whoever's in your family. And you don't have to be as heavy as your siblings or your parents. You don't have to smoke like your parents. If there's any history of blockage of the coronary arteries, early death before the age of 50, or any kind of cardiovascular disease, then it puts a check mark on you. These gowns are terrible, by the way, and the food, it's okay, but what happened to me was I was at Amazon Fresh. I was doing patient care. Just as I disconnected with a patient, I had chest pain, and it was substernal, a 1 on a scale of 0 to 10, but it wasn't going away. What could those be? Exactly what I told you: stomach, lung, or heart. Could also be chest wall as well, but typically for what we're going to talk about, stomach, lung, and heart, those are the three big ones. If you're older than 50, then it should be heart as number 1, lung as number 2, and stomach as number 3 in the differential diagnosis. Differential diagnosis is our working plan. If you're younger than that, say 20, just to make it an easy argument, then we think stomach first, then lung, then heart. Then we go with symptoms. If you had a 10 out of 10 crushing chest pain and shortness of breath, then it doesn't matter what age you are, it goes the heart first, lung second, and stomach last. All three have intensive interventions that have to be done depending on your medical disease. That's the third thing. If you have, say, asthma, then the lung comes first. If you have palpitations or a pacemaker, no matter what age, then the heart comes first. If you have history of ulcers with GI bleed, or gastric surgeries, or if you're on Ozempic, then the stomach comes first. But the history is also important, like the events, what led to it, how long it lasted, did you pass out? Based on how we prioritize, we also take a physical exam. The physical exam kind of hones in and tells us, where should we concentrate? Do we hear anything that's obvious? A wheeze? Do we hear a weird S3 or S4 sound, or a murmur that's new? Or do we hear or feel an irregular pulse? Or is your belly painful? Are you having blood in your stool when we check you or when it's checked? All those things are important, and they helps us to hone in and narrow down the diagnosis. And finally, we do testing. Whether it's blood testing, imaging, or other tests, we put all those things together and we figure out what's going on with you. Science has come up with enough testing protocols, but within the protocols, you also have to know what's going on with the patient and know the history. If you have a patient that has severe anxiety, then you might water down the severity of what they tell you, but you don't ignore it. Muscle pain or musculoskeletal causes are the last in the diagnoses, and the first three that I talked to you about, heart, lung, and stomach, are the most important things to rule out. Yesterday, when I was finishing up with my patient, I had the chest pain. It was substernal. It was 1 on a scale of 0 to 10, but it wasn't crushing, possibly radiating to the back. Then I had diaphoresis, or sweating, and that was unusual. So already there's a red flag going up. In addition to my age and my family history and all the other things I mentioned to you, after 5 minutes, I became a little bit dizzy. My first inkling was to lie down. And I thought that's the safest thing to do, but I'd be looking weird in the Amazon Fresh lunch area. I packed up my gear. Then I stood up and I thought, ooh, that's weird. I'm not only with 1 out of 10 chest pain, not only sweating, but I'm also dizzy. And then those are red flags that had me pull out my phone and call 911. And the response time where I was less than 5 minutes, 2 minutes. These guys were quick. If I was on a plane with chest pain, sweating, and dizziness, they would have to divert the plane to the closest city and the closest emergency room or airport, but the plane would have to land, no matter how close I was or how far I was from destination or arrival. And that would really piss off a bunch of people, but who cares, right? They got me in the rig, and they did a 12-lead EKG. That's when you put the tabs on, these tabs, to get a vector analysis of your heart. So my EKG was normal, which they allowed me to read it myself, and it was normal. Blood pressure was controlled. meaning less than 120/80. And then heart rate and oxygen and glucose were normal. They immediately started an IV and took my glucose. And they gave me the options of taking me to the closest hospital. But I took a look at the EKG and I said, you know what, I appreciate you guys, but I'm going to call my son, have him take me to my hospital, which is St. Alexis. The ER doc conferred with me that the symptoms were enough and the age was enough and the history was enough to keep me overnight. Luckily, my cardiology friend, Dr. Doshi, also conferred that it's probably safer to get the workup and have them take a look at me. And that's where I am now. I had the typical 3 troponin blood tests were all negative. EKG was normal still. Because I was just on a flight a day before, I always have to be careful about blood clots, but that test was negative and I chose not to do the CT angiogram of the chest. That's the test to look for a blood clot. I'm pretty confident it's not going to be cardio because of the investment in time that I do with exercise and nutrition changes and controlling my cholesterol. I think I've told you in videos in the past, your LDL should be less than 80. I don't like LDLs, I like apoprotein Bs. I think they're more indicative of atherosclerotic heart disease, and my apoprotein B is 61. I'm trying to knock it down to 44. That is how we go about figuring what's going on with you. You should trust the doctors that see you, but in some cases, you have to have an advocate. And for my patients with my practice, I'm the advocate, so I give them guidance on what to do. I do have patients in other states and other countries. If they have to go to the emergency room or see somebody in immediate care, that's different, but I still guide them on what to expect and what to ask. But if you don't have anybody to be an advocate for you, sometimes the default would be you're like the average person. And that's what the story here should be, is although there are algorithms and routines, I think that everybody should be treated individually, and to apply a general algorithm that has been developed over 1,000 to 1,000,000 people, to apply that to an individual, it's a guideline. It's up to the physician and you, an advocate, or your family members to figure out how to apply the guidelines. I think it should be shared decision making on what to do next. Heart attacks are the #1 killer in males and females in the US. To advocate for individual choices, the ecological fallacy says that you can't apply large studies to the individual. There is a lot of data that anyone can access. You can kind of come up with ideas using those same guidelines that doctors use. But I have to warn you, there's a lot of patients that will read everything and they'll come up with an algorithm on their own or a decision-making process on their own, and it's empowering to have information, but to wield that kind of weight and decision-making without the experience of being a physician is a little bit dangerous. Doctors don't make money off of you getting more tests, though I do a lot of tests to get as much data as possible. I don't get any kickbacks. That's called Stark 2. You cannot get kickbacks from the places that you order blood tests from the x-ray places, the imaging places, the second opinions. There's a suspicion that doctors make money by sending to their friends or sending to the hospital, and we don't. In fact, we probably lose money, if anything, because we lose time, and time is important. Time is always going to be important to figure things out. So when you go to somebody who only spends 10 minutes and doesn't let you talk, you have this and you need this, and they don't ask you about anything else, that is a problem. Now granted, if you go to an emergency room or a immediate care center or a regular primary care doctor's office, in many cases they're running behind, has a backlog of patients right behind you that, I mean, you can't spend an hour with everybody. I do. I spend an hour at least with my patients online with my virtual clinic. Patients get better. I like to see people conquer the diseases, not be reliant on prescription medicines and devices or being in here. I believe I can provide better than average, if not outstanding coverage and advice in my area for my patients. And that's why I love what I do. But I am a human like you, and I'll have chest pain like you, but I will not be remiss because I know I've invested a lot of time into exercise since the age of 18, and I'm maintaining it till now. I walk the walk, and I will do everything in my power to have my patients end up the same way as me, hopefully avoiding the hospital. So thanks for watching up on this point in time. If you have any symptoms, please see your doctor. If you have any questions, put them in the comments section down below, and consider subscribing to my YouTube channel. I put out content that is for the personal approach. I'm not trying to promote anything. I'm not trying to sell anything except for your health. So thanks for watching and stay healthy.